right, looks like we have some people already logged in. We'll get started in just a few minutes. And if you want to go ahead and put where you're from, maybe what you do, into the comment box, we just want to make sure that everything looks good. We're going to have that area to the chat box for questions. So if a few of you wouldn't mind going ahead and putting something in the chat box just so we can make sure that that's working well. The Casa Grande Alliance, thanks for joining us today. Oh, great. We have someone up in Douglas, a health educator for tobacco prevention. Great. Hi, Candace from Flagstaff. Oh, wow. Anchorage, Alaska, tobacco treatment specialist. Thank you for joining us. So we have Cochise County Youth Health Coalition, another Alaska attendee. Very exciting. I'm envying your weather right now, I have to say. Jesus, the Urban Indian Coalition, Pinal County Juvenile Court Services. This is a great representation of the state, so thank you all for coming today. Pinal County Public Health, Anchorage, Alaska. And can everyone hear me okay? Okay, that's good. Thank you. And we'll get started in just a couple minutes. Okay, well, it looks like it's 12 o'clock, so we are going to get started with our webinar. Today we will be discussing e-cigarettes and nicotine, the harms and rising numbers. And my name is Talia Williams. I'm the program director here for DrugFreeAZKids.org. And also joining us today is Dr. Erin Skolnick from Banner Health. And I want to thank you all for attending. And if you would type when you have questions in that box as well, and then we're going to address those questions towards the end. So today we're going to be hitting on why it's important to connect and educate youth about the harms of e-cigarettes and nicotine. We're going to be discussing the trends of e-cigarettes and nicotine. We'll be hearing from Banner Poison Center, and then what you can do to get involved. So the average age of first-time drug use in Arizona is 13. And it's not a matter of if, but when your child will be asked to use drugs and will be exposed to drugs. And kids who have talked with their parents about the dangers of drugs and alcohol are up to 50% less likely to use. So parents really do have an impact. And this is why it's so important for parents to help educate their kids about drugs. So we want to look, first of all, we're just going to start off with tobacco and see some of the trends with tobacco. And as you'll notice, tobacco use has dramatically dropped, and this is a very good thing. Even though tobacco use has gone down due to smoking bans, that's part of the reason, with the policy changes around that. Advertising campaigns such as The Truth About Tobacco, there's been widespread campaigns and prevention of people on the dangers of tobacco, and that's been very effective. And there's also been word of mouth. Kids, really do know that you can get lung cancer. They know that, tobacco causes wrinkles and yellow teeth. That is very well known. Kids don't know right now about the dangers of e-cigarettes, and so that's part of the reason why we're bringing this webinar for you today. But I did want to note that even though the dangers of tobacco are well known, what we don't want to do is forget to still educate about it, because that tends to use will tend to increase if you stop educating about a subject. So we still need to let kids know that tobacco is very dangerous. But if you look at e-cigarettes, you'll notice the trend that e-cigarettes are on the rise. Use is on the rise. So this is from the National Youth Tobacco Survey. We don't have Arizona-specific data yet available on e-cigarette use. But there is a national trend of increased e-cigarette use among youth. And this is showing your 30-day use among high school students in particular. And you'll notice off to the side we did put a couple ads that show that they are getting compared, e-cigarettes are getting compared to cigarettes, and saying that, well, you can now have a cigarette without the guilt, take back your freedom, for the people that were upset that tobacco, all the bans and tobacco smoke. So there's a lot of powerful messages out there that are the youth are getting, that e-cigarettes are potentially a good thing. And so they're just not hearing yet, like I mentioned, that e-cigarettes are potentially harmful. And so this is the another study from the Monitoring the Future, just to show, again, the comparison that cigarette use is declining and then e-cigarette use is increasing. And this is also past 30-day use. And this is a slide to show that among middle school students, e-cigarette use in the past 30 days has more than tripled, from 1.1% in 2013 to 3.9% in 2014. So even though you're supposed to be 18 years old, young kids, 12-year-olds are getting their hands on e-cigarettes. And I wanted to show you guys a little bit about, how they work. E-cigarettes are designed to simulate the effects of tobacco smoking, but not have that smoke that's so chemically dangerous. So some devices are disposable, while some are reusable. So the e-cigarette is pictured on the left, and the vape pen is pictured on the right. So what it consists of is a replaceable cartridge that contains a liquid, an e-liquid, and often that liquid is flavored. And so an atomizer will work with the battery or some other kind of power source to heat up the liquid, and then the user will inhale that vapor. And so initially, the e-cigarettes seem cheaper than the vape pens, but the vape pens eventually, you can actually refill the tank, so you might be able to save money on getting one of the vape pens because they're longer lasting. And then some of these are activated by inhaling, and some of them have a button. And the nicotine level will vary on these devices, and it just depends on what kind of cartridge you get. Some range, the most of them range between 1.8% and 2.4%, but some of them do have higher concentrations. And if you go looking around the sites on the internet, you can find up to 10% nicotine available. And so in just a few minutes, Dr. Skolnick's going to be talking about the dangerous aspects of the nicotine e-liquids. So the vape tricks are something that's really catching the attention of youth. And this is youth across the country, because they're able to get on the internet, check out YouTube, and see videos of kids performing these tricks. Or they can go to a vape shop and watch this themselves too. What these are called, there's competitions actually going on called cloud competitions, and performers are forming clouds and smoke rings. And if you'll see pictured, you'll see the smoke rings on the left, like a guy blowing, I don't know how many directions coming out of his nose in the middle. And then the fellow on the right is actually forming a ring to go around a bottle of what it looks like whiskey. So the e-cigarettes produce a lot of vapor, so they're able to do these tricks, which would be much harder to do with a cigarette. And they're getting, in some cases, thousands of dollars if they win these competitions to create the biggest and densest vapor clouds or so-called the coolest trick. So this, as you can see, this would be really appealing to a kid. And some other things that are sparking kids' attention are the flavors themselves. You can get, and there's so many different flavors that you can get. Anything cherry, chocolate, bubble gum. There's alcohol flavored, such as single malt scotch and cappuccino, coffee flavors. This can all be attractive to kids as well. And then there are e-liquids that are available without nicotine, or they have a trace amount of nicotine. But it would be really confusing for a youth to be able to tell if they're handed an e-cigarette, which ones have nicotine and which ones don't. So another concerning trend is the vaping with hash oil. We've heard reports from police that say that some kids are adding hash oil to their vape pens. And this is making it easier to disguise. It's making it, there's less of a smell, and it'd be easier for them to use this in public, use marijuana in public. So that's another thing that we're concerned about. Well, I would like to, we're going to have Dr. Aaron Skolnick with us, and he's going to be discussing the toxicity and medical impact of nicotine and, what they're seeing at Banner Health. And I am just going to read a few words about Dr. Skolnick before he joins us. He is the assistant professor in the Department of Emergency Medicine at the University of Arizona College of Medicine in Phoenix, and he regularly teaches medical students, residents, and fellows. He works in the ICU as a medical toxicologist, and he's the assistant medical director of the Banner Poison and Drug Information Center. So thank you so much. He's going to join you in just a moment.
Hi, good afternoon, everybody. Talia, thanks for having me, and thanks for that nice introduction. Let's talk about what we've heard about through our Banner Poison Center. So this is data from our center, which serves Maricopa County. And from 2011 to 2014, we had about a 10-fold increase in calls related to exposures to e-cigarettes. And in this case, the vast majority, or 70%, involving children under 2 years old. And these are typically exposures to e-cigarette refill liquid. So as we'll talk about, the liquid itself can contain extraordinarily high contents of nicotine. And there is a danger, one that we don't often talk about, especially to young kids, toddlers and smaller, from nicotine exposure. At the same time as we've seen this increase in e-cigarette related calls, conventional tobacco exposures have fallen by about 35%. Tobacco replacement product exposures, such as nicotine patches, lozenges, nicotine gum exposures have also fallen concomitant with the rise in e-cigarette related exposure. And we think, although it's impossible to prove causation from this data, that this probably represents a trend in the use of tobacco and tobacco cessation products among parents and family members of these exposed children. Let's take a look at our year-to-date data from 2015. So we get about 4 to 6 calls per month about exposure to e-cigarettes. The majority of those, again, in children less than 2. A couple caveats to interpreting Poison Center data. So remember that although we do our best to educate folks that they need to call their local poison center, their regional poison center when there's been a toxic exposure, all of this is self-reported data. So if I'm a parent and I'm using e-cigarettes for whatever reason, and my small child gets exposed to the e-cigarette juice or the vape juice as they call it, I may be worried that if I call in to the poison center that somebody's going to say I'm a bad parent, or they might get child protective services involved. We know that even for things that are not like this, accidental pediatric exposures, that poison center data is very much underreported because of the self-reporting phenomena. Likewise, we depend on healthcare providers to call us. So if I'm a physician working in the emergency room, as I also do, and I see a child that's been exposed to vape juice, I may or may not remember to call the Poison Control Center. If I don't feel that I need advice from Poison Control, perhaps I manage the child myself and I send them home, and thus the Poison Control Center may not get the best quality data about trends in youth. It's certainly possible also that some of these children have more mild outcomes and that they're just managed by their parents at home who might be blissfully unaware of the danger posed to their children. Let's take a look at some nationwide data. This comes from the American Association of Poison Control Centers. And so nationwide, between September 2010 and February of last year, e-cigarette exposure calls increased from only 1 per month to 215 per month or more, which reflects a nationwide increase in use. nicotine toxicity reports tripled between 2012 and 2013 alone. Similar to our local data, the exposures are mostly young children, age 0 to 5, that's the majority, and then 42% of those exposures in folks over 20. So that's probably adults exposed through use. One thing to note is that folks who are exposed to e-cigarette or e-cigarette refill liquid are much more likely than those who are exposed to cigarettes or conventional tobacco products to have experienced some adverse effect. And we're going to talk about why. So the health effects, this is what everybody's been waiting for, and I have to apologize because the long-term health effects of using nicotine chronically in this form are truly unknown. We can probably speculate somewhat about the relationship between e-cigarette juice and conventional tobacco. We could say that what we know about what's in it suggests that it's probably less harmful than conventional tobacco, but of course, like you, that doesn't mean I want every adolescent or child or even adult to be exposed to it. It may be the lesser of two evils, but it's probably not good for you. And we do have lots of data from nicotine, which we know is toxic, that suggests that it would be a shock if we didn't see some adverse long-term health effect from chronic use. The danger that concerns me from a public health perspective is twofold. So one is, because of the lack of regulation, just like with illicit drugs, you never know what you're getting. And in fact, there's pretty ample data that the labeling of these products, which are produced sometimes by unskilled workers in local shops, really doesn't reflect what's inside, and we'll talk about what's inside. So that's a big problem. Likewise, in the absence of regulation, it certainly makes it easier for folks that we don't want to have access to this product, that is, children, adolescents, who are unable to make the kind of informed choices that historically we've allowed adults to make, even if it's bad for them. It's easier for them to get it without regulation. So that's problem number one. The problem number two that I'm going to talk about next is the danger posed by the liquid itself, because nicotine is definitely a poison, and here it's available in amounts that far exceed any exposure that could be had through conventional tobacco products. So let's talk about that a little bit. So first, looking at a single cigarette. So I'll tell you that historically, many poison centers have used a referral threshold. That means a child is exposed to this. Do I send them in to be looked at by a physician or a healthcare practitioner? So many poison centers have used a threshold of 1 bowl cigarette or 3 cigarette butts. So the morning after the party, cigarette butts are lying around the house, and Timmy the toddler, who's 2 years old, eats 3 cigarette butts. That child has the potential for life-threatening illness, needs to go into an emergency department and be observed. Okay, so keep that in mind. And the total amount of nicotine in 1 cigarette typically ranges from about 10 to 30 milligrams, depending on the brand, depending on the size, etc. The amount that's absorbed when you smoke a tobacco cigarette is actually much, much less than that. So at the most, probably about a third in a conventional user, and sometimes even far less. Now let's compare that to vape juice or refill liquid for e-cigarettes, right? So the amount of nicotine that's inhaled per puff, if you test it in a lab, is probably similar to a cigarette on a per puff basis. But the amount of nicotine absorbed is very different, perhaps. So it really depends on the product, the refill concentration, the e-cigarette or vape pen that's used, and the technique of the user, right? So if you inhale and hold your breath for longer, you may absorb more of a particular dose of nicotine. Here's some of the stuff that's in that. And so, you know, I don't want to be sensationalistic about it, but this again is a list that reflects only what we know, and it reflects an unregulated product. And so whenever a product is unregulated, we can't be sure that the ingredient list reflects what's in it. And as I'll tell you, there's been some data that suggests that with fair frequency, it doesn't reflect what's in it. The vast majority of vape juice, though, is something called propylene glycol. And this is very, very common. There's versions of it in so-called safe antifreeze. But believe it or not, this is an FDA-approved food additive and medication diluent. Most of us who are on the webinar today probably ate some of this today in something that we ate. And if you were to go to the hospital where I work, frequently the intravenous medications being given contain propylene glycol as a diluent. So like many things in modest amounts, there's not a great reason to suspect that that itself is bad for you. But other things that have been found in e-cigarette juice or refill juice include methyl salicylate. So methyl salicylate contains large amounts of salicylic acid, the ingredient in aspirin. And aspirin, of course, is toxic in large amounts, like many drugs. Methyl salicylate is the form that you might find in a liniment or something like Bengay. So it's commonly added to this to produce a change in flavor or the perception of a menthol type experience. Now we know that if it's ingested in large quantities, it can be very dangerous and even lethal to kids, and we don't really have great science to tell us how much of it, if any, is absorbed by inhalation in the form of vape juice. Then there's this fancy word, nitrosamines. So nitrosamines are products that are found in natural tobacco, and in fact, when we talk about health risks of tobacco, we frequently call these tobacco-specific nitrosamines, or some people abbreviate it TSNA. And these are really bad for you. They're associated with a number of cancers. So far, the data suggests that these can be present in vape juice, but they are present at manifold lower levels than in conventional tobacco smoke. So I think what we can say there is, if they're present, they are present in an amount that we don't know is or isn't bad for you. We know that the compounds themselves are bad for you, and with respect to conventional tobacco products, this is probably a case of the lesser of two evils, but the potential danger of this, as far as e-cigarettes, is still unknown. Okay, diethylene glycol, another thing that's historically been used as a toxic additive to medication, but we don't know if any of it is absorbed in this form. And then trace metals. So metals are commonly found in natural tobacco products because if you live on Earth and you grow something in the soil, it tends to take up small amounts of the metals that might be found in the soil. And you have probably heard some of these things in respect to products like apple juice or rice baby cereal, right? Because some of these trace metals are things like arsenic or chromium or lead. The data on this as far as e-cigarettes is mixed. One large study done in New Zealand didn't find any presence of trace metals in the refill juice itself. Another study looking at the content of vapor found some trace metals at levels that are not known to be harmful, but were much higher than advertised by the manufacturer of the product. So that's worrisome. And the other thing is that these trace metals may come from the vaporizing element itself, right, which is usually made of metal that's electrified to induce some heat and atomize the liquid. And so that's something that could potentially cause harm, but may be able to be manufactured out if there was some regulation of this product, which there isn't right now. And then the second bullet point here talks about the FDA warning to several manufacturers of e-cigarettes because they were advertising that their refill juice contained pharmaceuticals, right, which is not allowed. If you don't have FDA approval for an indication, you can't advertise a pharmaceutical or a drug effect. And what kind of pharmaceuticals were they advertising? Well, they advertised Rimonabant, which is a weight loss drug that has never been approved in the United States and was briefly approved in Europe. And then they advertised Tadalafil. And Tadalafil, some of you may know, is the brand name Cialis. And this is a drug for male erectile dysfunction. Now, when they went back and tested these particular products, they found small amounts of chemicals that either were or were closely related to the drug, but there was actually no evidence that if you vaporize this or you use this, that you would get any effect, whether good or bad, of these medicines. But it just shows you that without regulation, manufacturers will make unsubstantiated claims and that there's a risk that what you buy is not what you get. All right, so now onto the part that really frightens me, and that has to do with the nicotine content of some of these refills. So refill concentrations in the literature until recently have been reported at between 8.5 to 22 milligrams per ml, right? So most of us don't think in mLs unless we're scientists. We think in teaspoons. So it's 5 mLs in a teaspoon, right? So at the lowest concentration, you're talking about putting the entire nicotine content of, say, 5 conventional cigarettes into a teaspoon of liquid. And we said that if a child eats 1 cigarette, that means they need to go to healthcare and get looked at for most regional poison centers. So that's really dangerous. Then we see that the concentration can increase above that twofold or more. I recently read a paper in which concentrations were 34 milligrams per ml, so almost 3.5 full cigarettes in every fifth of a teaspoon. And then the refill sizes, right? So we live in America. We like to buy things in bulk and save money. Well, you can get a refill that's a teaspoon size, but you can also get them up to many ounces. And I'll use the example of 16 fluid ounces or a pint. So a pint of refill liquid, okay? So the estimated lethal nicotine dose in the literature is about 1 milligram per kilogram of body weight. And the nicotine in a pint-sized bottle might be up to 10.5 grams. So what does that mean? That means that that bottle contains the nicotine equivalent of over 1,000 cigarettes. And that's enough to kill either 150 70-kilogram adults or 750 average-sized 2-year-olds in a single pint-sized bottle of refill liquid. So you can imagine how dangerous that is to have sitting around the house, especially if the thing is labeled bubblegum or strawberry or something attractive to children, which it frequently is. Let's talk a little bit about the health effects of nicotine in toxic amounts. I should mention that so far we don't have science to suggest that it's very easy, if even possible, to poison yourself with nicotine through the process of using a vape pen the way it's meant to be used, even at high concentrations. But my primary concern in this section of the talk is again about small children or those who know no better or adults who wish to harm themselves ingesting this liquid. Okay? So we have receptors that are called nicotinic receptors throughout our nervous system. We don't call them nicotinic receptors because our bodies were designed to have nicotine in them. They weren't, right? We call them nicotinic receptors because somebody 50 years ago figured out in a lab that we could activate these receptors with nicotine, right? And in fact, these receptors are involved in alertness and attention and memory. And way back in the day, when I'm embarrassed to say that doctors recommended people smoke cigarettes, these are some of the things that they were probably getting at, right? Things, effects on digestion and effects on alertness and memory. But we now know that the bad effects far outweigh any potential good effects. If I stimulate the nicotinic receptors in my brain too much, I get overstimulated and I will have a seizure or may have many, many seizures back to back. Let's look at the peripheral nervous system. So this looks like a complicated slide, but I'm going to try to make it really simple so everybody can see what we're worried about. We have different branches of our nervous system, right? So we have motor nerves that come from the brain, and when our brain gives a command, a signal travels down those motor nerves and it goes to nicotinic receptors that sit on our muscles, and it tells our muscles to twitch or to contract. So the danger from nicotine poisoning is that if we activate all those receptors on muscle, we can have diffuse muscle spasms, and ultimately the muscle gets tired and fatigued, and then it becomes weak, and ultimately it becomes paralyzed for a time. And that's something that we see with severe nicotine poisoning. These other branches of the nervous system we call the autonomic nervous system, and these are the nerves that regulate what we think of as the fight or flight response. So first, the parasympathetic nervous system, which regulates the so-called flight response. All of our ganglia, all the junctions in that portion of the nervous system, again, have nicotine receptors. So if we were to ingest a large amount of nicotine, we could get all these nerves to be stimulated, and we would see effects like profuse sweating, drooling, vomiting, diarrhea. We could see really low heart rates that are not capable of sustaining life, and we might see bronchospasm or difficulty breathing or wheezing. On the other side of the autonomic nervous system, which we call the sympathetic nervous system, that's the traditional fight response. That's when we get our adrenaline going. And so again, we get these effects that mimic those of adrenaline when we stimulate all these receptors. So we might see really high heart rate or really high blood pressure in this case. When we ingest nicotine, the problem is it goes everywhere. And instead of having tiny amounts of normal neurotransmitters that activate receptors and get our muscles or our body to do what we want it to do, it causes a diffuse poisoning, and we'll talk about the clinical effects in the next slide. So early on, we might see some of what we call these cholinergic effects, or the so-called flight effects: sweating, uncontrolled tearing, drooling, and the drooling can be so bad that people can choke on their own secretions, vomiting, diarrhea, uncontrolled urination, or severe trouble breathing. As the poisoning progresses, we may see seizures, we may see muscle spasms followed by weakness and paralysis, and we may see shock. We may see the heart and blood vessel system collapse. Okay? So when people do die from severe nicotine poisoning, some of the things that they may die from are complete paralysis of their breathing muscles, shock that doesn't respond to conventional treatments, or they may have continuous seizures. And if one seizes for long enough, that can cause the brain to swell, and when it swells enough, that's irreversible, and the patient will die. So how do we treat this when we treat severe nicotine poisoning in the hospital? Well, if a patient's unable to breathe or they're unable to manage their own secretions or vomiting, then we place a breathing tube in their trachea and we put them on a mechanical ventilator that breathes for them. Sometimes we'll try gastric decontamination. In general, we don't do this for very many poisonings anymore, but if I knew that a small child had ingested a lethal amount of e-cigarette refill liquid, I'd probably place a tube into their stomach and try to suck out as much as I could if it was early, because we really like to avoid these potentially deadly effects that we saw on the last slide. We certainly can give medications to help to try to treat seizures, but depending on the dose of nicotine, they may not work or they may not be enough. And then we provide general supportive care, typically in an intensive care unit for a patient like this. The other additives that I mentioned in vape juice, they certainly are all capable of causing some toxicity. We just don't know whether they might cause toxicity in the quantities in which they would be ingested. And with that, I'm going to turn it back to Talia so that you can learn what you can do to try to prevent the exposure and try to prevent these kind of poisonings. Thanks, Talia.
Hello. All right. So one thing that you can do right now, because the FDA has not regulated e-cigarettes yet, and they are listening to the public, and they've had several different comment periods. The comment period that's happening right now is ending very soon. So you need to comment by July 2nd if you are interested in letting the FDA know your concerns with e-cigarettes. So what you do is you go to regulations.gov. You want to type e-cigarettes in the search box, and then you want to look for electronic cigarettes in the public health, and then click comment now. And then your information that you enter will be viewable on regulations.gov. And they do give you some tips to help you write an effective comment. They look for logic, they look for good science and other evidence in the comments that they evaluate. They want data, research, analysis, and you want to be clear about your position as well. So that's one way you can, share this with the group that you represent. If you're in a coalition, have them write out to the FDA. If you're concerned about e-cigarette use, especially among youth, it's definitely a good idea to let the FDA know. And then as a parent or as a person that interacts with children at all, you want to make sure that you have a role in educating them about the dangers of nicotine, e-cigarettes, and just drugs in general. So we like to say the 3 C's are really important: conversations, contracts, and consequences. So having regular conversations with your child about drugs and alcohol is just so important. You want to take the time to learn the facts yourself so that you can then educate them and that they get information that's accurate. So, kids are getting information from school, their friends, anywhere but necessarily the truth, right? So you want to make sure that you are a good source of accurate information. And then make sure your child also knows your expectations, what they are, where you stand on drugs and alcohol within your family. And having that family policy or a contract that's very clear and specific lets everyone know, stay on the same page, that if you have a no alcohol or drug use policy in your family, everyone knows that. They know why. They know what the consequences are. And then taking the time regularly to review and update that contract or family policy is very important as well. And then you want to also build resilience within your child. Listen to them. Let them know what they're struggling with. Have they been exposed to drug use? Make sure you know this. And then taking the time to role play scenarios with them in which they might encounter, or in which they might encounter this, where they're approached to use drugs. So do they know ways to say that no? Do they know that they can sometimes make an excuse, blame their parents, give a reason? And also hanging out with kids, of course, that don't use substances. And then really, really important, you've got to have a rescue plan so that if your kid is exposed to drugs or is just in danger at all, they know that they can call you, no questions asked, and that you'll come get them. Okay, so just wanted to show you guys our website. If you haven't been to our website yet, we definitely encourage you to go. And if you have seen it, we've made some updates recently, so please take a look. You want to, if you're interested in finding treatment services, if you go under Get Help and look under Treatment Locator and put in your zip code, there is an updated list of resources by zip code. We have our webinars. They take place nearly once a month. We send out blogs and e-newsletters every month. You can check out the drug guide, which we have updated with various substances. You can go to our calendar and find out where we're having parenting workshops and presentations. And then under the parents section, which is highlighted right there, you can find downloadable tools and how to have those difficult conversations with your kids and other things right there. So right now what I'm going to do is I'm going to click on a survey. And if you could please just take a few moments to take this survey. It's very quick, and what we're going to do, it's just a couple questions, and it really helps us with planning our programs and just keeping our programs going. So there's the survey. So I'll just give you guys a minute to do that. So while we're doing the survey, are there any questions for myself or for the doctor? And we may actually share the screen during this part. See if they have any questions. Like this. Don't see any yet. Will the recording be available? Yes, we will. Within a week, we will have the recording available. And what we'll do is we'll send you an email to everyone that participated today. So we'll give you the link to that recording. Any other questions? Are any of you educating on e-cigarettes within the groups that you work with? So I'm going to go back to the next slide. I just wanted to let you guys know about our next webinar, which is August 19th. And we will be discussing substance abuse among elementary and middle school age kids. And so we're going to talk about this issue amongst the younger set. What are the contributing risk factors and methods that you can use to reduce the likelihood that they will engage in substance abuse? We have the Cochise County Youth Health Coalition. Let's see, is discussing, and they're educating on e-cigarettes with their kiddos, I'm imagining. Well, we must have done a good job then if we don't have any questions. Oh, here we go. If a parent calls with questions regarding e-cigarette juice, do we tell them to call the Poison Center?
Yeah, I think that's fine. You know, the Poison Center exists for several reasons. One is to help healthcare providers, but the other is to provide information about drugs and toxic substances, and that's everything from what's under your kitchen cabinets to e-cigarette liquid. And so I know on the Poison Center Directors Network, many of us have been very, very interested in this.
Oh my gosh. Shoot. We just died, I guess. Are we not plugged in?